Hello everyone. So we've gotten a lot of requests, and in this video we are going to talk about top 10 things you need to know about USMLE. So whether you are a medical student, whether you are an intern, whether you've just started your USMLE journey, or even if you are already in the journey and you are applying for the match, we are going to give you top 10 things that everyone needs to be aware of as you are in the journey or even thinking about the journey so that you can make an informed decision. Welcome everyone. So in this video, Dr. Reddy from our team and I will demystify the top aspects of USMLE. So whether you are still a medical student, whether you are an intern, whether you're thinking USMLE versus other options, we will give you the top 10 things. We will tell you the importance of those top 10 things. And of course, there are separate videos on these top 10 aspects of USMLE that you can dig into details. So there are 10 things that everyone needs to know about USMLE. First, of course, is the USMLE exam and the entire process. So we'll talk about the importance of various exams, including step one, which is going pass fail. The second is the specialties that most IMGs apply for, what you can target in the US as you go into the match. So whether it's internal medicine, pediatrics, and other specialties that you can target. The third is the US clinical experience, something which is very, very important as you do your USMLEs and plan this journey. So we'll talk about that. Then we talk about research, how research is becoming important in this USMLE journey for the IMGs. The fifth thing that we want to talk about is visa. It is critical for you to know what all these issues around visas are, what kind of visas are you eligible for after the match, J1 versus H1. So we'll talk about the visa issue. So then we will talk about the meat of the USMLE, which is once you've done the exams and all that, you have to apply to the programs. What type of programs should you be applying to? What is all this my ERAS thing? So the program selection we will talk about. Once we talk about program selection, the next thing we are going to talk about is something called the ERAS CV and the components of the ERAS CV, the letters of recommendations, the personal statement, and so on and so forth. After that, we will talk about interviewing. Interviewing is a critical aspect of USMLE and maybe very different from what you're used to in your home country. So what is interviewing? How do you prepare for it? What type of questions can you expect from interviewing? Then the ninth thing we are going to talk about is the NRMP. What exactly happens after interviewing? What is this match? How does this match happen and how you can play it smartly? Finally, the 10th, one of the important criteria that many of you have is the cost. So we'll talk about the cost of USMLE and how you can plan around the total cost of USMLE. So these are the 10 things. Now, we will have all these videos in chapters. So if you know about a particular aspect, you can skip to the next chapter. So let's get started and go into each one of these in detail.
Now let's discuss about the importance of USMLE in this journey. So the United States Medical Licensing Examination, or the USMLE, is a three-step exam. It basically assesses the physician's ability to apply knowledge, concepts, and fundamentals of medical studies. It is a very crucial exam for someone to obtain a medical license in the US. So although the USMLE is a three-step exam, only the step 1 and step 2 are required for ECFMG certification and before starting the residency. So the step 1 exam. The step 1 exam tests your knowledge in basic science subjects like anatomy, physiology, microbiology, biochemistry, and others. It is an 8-hour exam consisting of approximately 280 multiple choice questions. And then comes the step 2 CK, or step 2 clinical knowledge. It is an exam that focuses or tests your knowledge on clinical science subjects like medicine, surgery, pediatrics, OBGYN, and others. It is again a 9-hour exam consisting of approximately 320 multiple choice questions. It is important to understand the assessment in this exam focuses or relies heavily upon deeper understanding of basic science subjects and tests the clinical application of the same. So these charts over here tell us the importance of step 1 and step 2 CK exams. So according to the 2020 Program Directors Survey by NRMP, the step 1 and step 2 CK exams are the most important factors that the program directors consider when deciding on whether or not they should invite applicants, for interviews. And this is not opinion of a few program directors, but this is the opinion of over 90% of the program directors who participated in the survey. So this tells us how quickly about how important the step exams are. So although step 1 scores are considered as the most important factor in deciding the residency success, there has been a huge shift in this notion since the step 1 exam is going to become pass or fail from January 2022. So as of 2021, the step 1 scores are currently reported as a 3-digit score, and this 3-digit score is often used by programs to filter between applicants. But once someone who's going to take the exam, step 1 exam after January 2022, will not have a 3-digit score, and their scores will be reported as a pass or fail. And this has two major implications. So number one is there will be increased focus or stress on the step 2 CK exams and partly the step 3 scores. So the programs will always need some or the other objective criteria like scores to differentiate between applicants or choose between applicants. So this role will now be fulfilled by the step 2 CK score and step 3 score. So it will be extremely important and helpful for applicants to score high on these exams. Second is there will be more emphasis on the overall application or CV, like the research experience, volunteer experience, USCE, publications, good LORs, and others will gain more weightage in deciding the interview invites and will help people stand out. Here is another chart from the NRMP data, the most recent NRMP data, that tells us the average or mean scores for step 1 and step 2 CK for both US IMGs as well as non-US IMGs. So the mean step 1 score for matched non-US IMG is 237. And mean step 2 score for a matched non-US IMG is 243. So the step 2 CS and OET, as of 2021, the step 2 CS is permanently cancelled, and all IMGs or international medical graduates are required to take the occupational English test or the OET and be verified by one of the 6 pathways that ECFMG has in place to be ECFMG certified. The OET is an English proficiency exam and has the reading, listening, writing, and speaking subtests, and the ECFMG accepts an overall grade of B or above in the OET as a pass. And the next is another important exam, that is the step 3. The step 3 is an exam that can be taken only in the US, and remember that you need to be ECFMG certified to be able to take the step 3 examinations. The step 3 examination is a 2-day exam. Day 1 is usually a 7-hour exam, consists of approximately 230 multiple choice questions. And the focus of this exam is again around the basic science subjects and patient history, physical exam, and use of appropriate diagnostic tests. The day 2 is a 9-hour exam and has 180 multiple choice questions and certain number of case simulations. So the focus of this exam is to test your ability to apply medical knowledge into patient care, and it majorly focuses on your decision-making skills. The step 3 score has always been like an icing on the cake for residency applicants, and it has been an important way to stand out for those with longer year of graduation, gaps, or any other red flags in the application. Having a step 3 score before the application deadline is definitely going to boost your application and chances of interviews, and it will also cover up to an extent any gray areas in your CV, like low or average step 3 scores, any attempts, lack of inpatient rotations, or good LORs. We've also noticed recently that certain specialties like psychiatry are valuing step 3 score even more, and such a trend is only expected to increase into other specialties in the upcoming math season. And a 230 plus is generally considered a good score in step 3 exams.
So if you're just getting started and wondering what kind of specialties can you do your residency in the US, historically, IMGs have focused on 5 or 6 common specialties like internal medicine, family medicine, pediatrics, psychiatry, neurology, pathology, and so forth. But it does not mean that other competitive specialties are out of reach. I mean, IMGs have matched and will continue to match in, say, general surgery, OBGYN, even dermatology, plastic surgery, and all. Remember that for all specialties, there are few things that you need to consider. Scores are important. Now, of course, Dr. Reddy speaks about the average scores in various specialties. So depending on the specialty, scores may vary, but scores are important. Your electives or your US clinical experience in that specialty becomes important. Your research may become important. Home country residency, if you have, or home country experience you have, may be important. What kind of professional networks you have in that specialty in the US can become important. So there are these various factors that play into every specialty. But like I said, there are mostly these 6 specialties that most of the IMGs tend to focus on, that account for more than 90 to 95% of the IMG match. There are slight variations, of course, in visa seeking IMGs versus those who do not need visa. And what are these variations? So if you are visa seeking, as you can see on this chart now, internal medicine tends to be the most highly favored specialty by the IMGs. Some of the other specialties that the visa seeking IMGs are getting into, neurology, pathology has become easier. Neurology is becoming more competitive, but pathology, neurology, psychiatry is one. Family medicine tends to be there as well. So these are the ones for the visa seeking IMGs. Now the trends keep changing. So pathology is becoming slightly easier, open to visa seeking applicants. Neurology is becoming harder, so is psychiatry. And we have again separate videos on how to get into each one of these specialties, and I'll have a complete link below. Now, if you don't need visa, then the situation changes a bit. As you can see in this chart, internal medicine is still there, but then you see family medicine come in, then you see even emergency medicine and some of these other specialty comes in. So there is slight variation whether you need visa or you don't need visa. And, these tend to change year over year slightly. Now, the next question is, how do I get into these competitive specialties like general surgery and so on? So as we have done other videos on specialty specific approaches, many of these competitive specialty will need US research. They will need very high scores, for example. They will need US research. They may prefer candidates with home country residency. So if you have done residency in general surgery in your home country, that becomes important. And then, as you do more research, more USC in the specialty, it becomes easier. But remember, the barrier to entry into these competitive specialty is very high because there are a lot of American graduates who are getting into these specialties. So just as a side note.
Next, let's discuss about the United States Clinical Experience, or USCE. The USCE is a broad term used to classify clinical experience in the US healthcare setting, and it encompasses or includes observerships, externships, electives, clerkships, and sub-internships. It is almost a mandatory thing for international medical graduates because it helps, number one, for the candidates to gain letter of recommendations that can demonstrate their clinical acumen and knowledge. Number two, it helps the program directors gauge the applicants' familiarity in a US healthcare setting. And other important aspects about the USCE or rotations is it can give you an opportunity for research. It is a great place to build contacts and for networking, and it can be a topic of discussion in the interviews. So here we will try to give you an idea about what each of these terms mean and what is their importance. So first is the electives. Electives are hands-on clinical experience. They are on the top of the USC pyramid. They are very important and helpful, and they are not mandatory as a part of the home medical school's curriculum. So these are only done when someone is a student and cannot be done when one graduates. So another related term is clerkships. So this can simply be understood as electives that are required as a part of the home medical school's curriculum. Next is sub-internships. While sub-internships are same as clerkships for all practical purposes, this can be done usually when one is in final year. But some hospitals, like Larkin's Hospital in Florida, allow this even for graduates. This is a very valuable form of USC and is on par with electives. Next is externships. So externship is hands-on clinical experience that you can gain after you graduate from the medical school. So externship are great, but the challenge is about finding inpatient rotations because there are not many hospitals which offer externships. So if you do not have electives as a student, then definitely try to get some hands-on externships on the CV. So we at USMLE Sardi offer both hands-on electives as well as externships, and we will leave a link in the description below so that you can learn more about these opportunities. Next is observerships. So observerships are clinical experience that allow you to shadow a physician without any hands-on experience. So these are not as impactful as electives or externships, but these are the most common form of USCE that people do because other options may not work out for various reasons. A reasonable amount of time spent in a good university or community hospitals that take IMGs for residency can be very fruitful. And then about the tele rotations. So, with the pandemic situation out there, there has been an increasing trend towards telerotations, although they cannot compete with actual hands on clinical experience because they do not allow physical interaction with patients. But it is an innovative way to interact with patients. In our experience, telerotations and LORs gained out of them have been valued and discussed during the interviews during the 2021 season. In general, there is a lot of confusion about the place to do USCE, which is having more value versus which is not valued. So overall, the hierarchy for the place of USCE is a university program, followed by a community program or a community hospital with or without residency, followed by university affiliated clinics, followed by any other clinics. With CS being cancelled, USCE and LORs gained out of them have become a very important way for programs to assess the bedside manners and communication skills of applicants. And remember that having three strong US LORs is one main aspect of a successful residency match.
Next, let's talk about research. Now, research has traditionally been highly undervalued by the IMGs. The IMGs have no exposure historically to research and they don't tend to do research. But in this hyper competitive environment and step one going pass fail, CS being cancelled, this is an excellent way to stand out of the crowd and make it count. There are two things you will be evaluated on in this journey on research. One is the research experience, and then there is the research publications. And you need to start looking for research opportunities right from early years of your medical school, whether it is your research in the medical school, whether you've been able to do it as part of the electives in the US, whether it's basic sciences, whether it's clinical research, subspecialty research. Any and every research counts. So pay attention to research. Of course, we at USMLE Sarthi have trained over 300 students on research. Focus on PubMed journal indexed research. So it does not mean that the home country research is useless, but US research always counts for more. So focus on that. There are enough opportunities as you do your rotations, as you do research courses with us, you will have enough opportunities, but research is becoming increasingly important. This will come up in the interviews and even as they evaluate your CV, especially more and more important if you have gaps in your CV, if you're an older graduate, or if you have lower scores. So research is becoming important. Do not ignore it. Okay, now let's talk about the ERAS application. You'll hear this term very often, ERAS. So what is ERAS? Electronic Residency Application System. So this is a centralized online system that delivers your application with the supporting documents to all the programs that you apply to. There are few important components of your ERAS application that you need to be aware of in addition to other documentation. One is the ERAS CV. The other is the letter of recommendations. All programs require at least 3, but you're allowed 4. So the letters of recommendation and the personal statement. So these 3 are the important component of your ERAS CV. And let me take a minute to go over each one of them. So ERAS CV is a very important component of your application. This is where you will realize that the USMLE journey is beyond the scores. It gives an idea to the programs. It is a resume. It is the resume. It gives the idea to the programs on what you have done in terms of your experience. Now, it could be home country experience. It could be the elective experience. It could be the residency experience. So whatever work experience you've had, gives them that idea. It gives them the idea of your volunteer experience. It gives them the research experiences that you may have gotten. So all this will come together in the ERAS CV. Now, what is the strategy that you should follow? Right from the day that you start your journey, ideally you should try to decipher these components. You should understand why each of these components of the CV is important so that you can consciously start working towards it. Like I said, volunteering is important. Hobbies section is there. That is very important. Research section is important. So once you know what these sections are, you'll be able to have a very clear strategy around the ERAS CV. Let me also tell you what mistakes we have seen in the ERAS CV. A lot of times, first is the grammatical mistake. Now, remember, you're all physicians. Attention to details is most important. And a lot of times we see grammatical mistake. A lot of these mistakes, and these are very irritating. The programs don't like it. The second is repetition. You will see a lot of repetition, students saying that history, physical, without really trying to explain the new value additions that they have done, the new learnings they've gotten. So a lot of repetition in each experience. There's a lot of fluff in many of the series that we have seen. When I say fluff, means information that is just put there to make it look important. I was member of this committee, I was member of this committee, without having contributed to any of that. So that's fluff. And then there is outright lying. A lot of IMGs we've seen lie on their CVs without having actually done that thing. These things are very easy to catch. So some of these mistakes to be avoided. Some of the things that you should focus on is the clinical acumen. You should be focusing on teamwork. You should be focusing on patient-centric approach. You should be focusing on evidence-based approach to medicine. These are the things that they focus on, they like in the US system. So of course, like I said, for each one of them, we have separate video. This is just an overview of the CV. So these things are important in the CV, and focus on these things. So then the other important part of your ERAS application is a personal statement. Think of personal statement as your story, very personal to you. In about 700 to 800 words, you are articulating your point of view to the program, possibly with the help of some examples, some specifics on why you want to come to US, what has been the learning in your medical schools. If you have had gaps, then you're trying to explain those gaps. If you have low scores or attempts, some explanation of those. Obviously, you have to go through why that specialty. So again, things in about 700 to 800 words. It's an essay that you are communicating with to the program, highlighting your skills, your experience, your fit to the specialty, your fit to the program. That is what is personal statement. The third most important piece of ERA's application is the letters of recommendation. And this is where, Dr. Reddy spoke about the US clinical experience. Part of these experiences, the output which you get in terms of letters of recommendation. Most programs will want 3 letters of recommendation, but ERAS allows you to submit 4 to all the programs. US letters of recommendations are highly valuable, so keep that in mind. Also realize that the letters of recommendation that you get from electives are more important. So try to do electives if you have not graduated yet. And of course, if you've graduated, then there are hands-on experiences, there are observerships, and you can look up our website for these things. But letters of recommendations are important. If you're a recent graduate, probably 1 letter from your home country is okay. Remember, the letters have to be very, very customized. It has to be very personalized. Generic letters of recommendations don't really hold much weight. The other thing you have to understand is the waived and the unwaived letter. Waived letter means that you have waived the right to see those letters and the faculty have directly uploaded. So technically, you have not seen the content of the letter. Unwaived means you have access to the letters. Waived letters always carry more weight. And again, I'll point you to some other videos where we have discussed these letters in detail. But remember, the letter of recommendation, especially from US experiences, are key to your match in the USMLE. Also, before I forget, remember that inpatient experiences, letters from the inpatient experiences are more valuable. Letter from university programs in the US can be more valuable than letters from the hospitals are more valuable than letters from private clinic which are not affiliated. So keep that in mind. All right, after you apply to these various programs through the ERAS system, what happens next? Next comes the interviews. The programs evaluate your application and will invite you for interviews. Depending on the situation, it generally is on-site interviews. So you travel to the hospital or the program, but during the pandemic, most of the interviews were virtual. So depending on that, you will interview. Now, interviewing is probably the most decisive phase of your USMLE journey. It can make or break it. So whether the program likes you, whether they rank you or not, whether you eventually end up matching will come down to interview performance. In most programs, you will have possibly 2 to 3 different interviews with different faculty, 10 to 15 minutes each. It can depend on the specialty also, but 2 to 3 interviews. It'll be probably half a day long, so they will have other information about the program. They will have other sessions, but these one-on-one interviews will be about 10 to 15 minutes each. What do they do in these interviews? Interviews in the US are quite different from what you may have experienced in your home country. So they can ask you general questions, things like, tell me something about yourself. How was your travel today? Or why did you want to become a doctor? Or why have you been interested in, say, cardiology, based on, say, your personal statement and things like that. So there can be these general questions. There can be situational questions. Things like, what color would you be if you were given a choice? Blue, red, black, whatever. Or what vehicle would you be? So situational questions. Some of this can be medical questions. Some programs like to ask medical questions, not a whole lot though. So in our website, we have a complete list of questions that you can go through. We have other videos as well on interviewing, but I wanted to give you the sense of what this was. Now, the trick to nail these interviews is not to memorize these answers, but to have a framework in place. And we talk about the interview answers, the framework, in a separate video as well. So have a framework in place where you can highlight the top points you want to come across. Always have it time box, so 90 seconds or so for each response. But interviewing is a skill that comes with practice. It cannot come overnight. So as you get through this journey, always think about interviewing. Always assume that you're talking to the program director. There's something called elevator pitch. How would you convince someone of your response in, say, 90 seconds? That's all about interviews.
And then let's discuss about the costs or expenses in the USMLE journey. So the journey to US residency not only demands a strong passion and determination to it, but also a need to plan and be prepared for expenses at various stages. The overall or average cost from start to match for an IMG is around 21,000 US dollars to 25,000 US dollars, and that is around 15.5 to 18.5 lakh Indian rupees. And depending upon other factors like number of cycles applied, number of programs applied to, paid versus non-paid rotations, in-person versus virtual interviews, and having a family in the US and others, the cost will vary slightly. But after all, you will realize that this is the best investment that you made in your life. And for more details about the cost, you can watch our other video on cost on the USMLE Sardi YouTube channel.
So now let's talk about visa. This is one issue that will come up for you if you are not a US citizen or a green card holder and you need work authorization to do your residency in the US. So to do the residency in the US, you need either an H-1B visa or a J clinical visa. And of course, there may be visas like H-4 EAD or any other kind of work authorization. Now, remember, this is different from when you're visiting the US as maybe a student to do electives or otherwise, where you have a B1, B2, or any other tourist visa. For residency, you need a work permit, H-1B or J-1 visa. Now, a lot of times you may not have the option to choose which visa, H-1B or J-1, depending on the program, because the program you match into already may have decided, or they may have the conditions of one or the other visa. However, you should know the pros and cons of both the visas. So for example, if you have a J1 visa, the advantage is most fellowships are easier. Most university programs actually go in for a J1 visa. So those are some of the advantages of J1. On the other side, J1 visa, you have to renew every year. You may have to go out of the country if that is the case. And then it becomes an issue when it comes to waiver jobs. So you may need waiver jobs after you complete your residency or fellowship on J1. So those are some of the issues that could come up. Now, when it comes to H-1B visa, of course, you don't need a waiver job. So immediately after your residency, probably if you're interested, you could apply for green card and things like that. So that path becomes faster on H-1B. However, remember that the programs offering visas like H-1B are less in number. So your option to do a residency on J1 anyway is increased because the number of programs on H1B is quite less. But of course, if you get an H1, it's a 3-year or so duration, so you don't have to go out of the country every year. You get it stamped once. So there are some logistical issues which are easier to manage with H1B. Having said that, visa is least of the issues because even if you need visa like an H1B or a J visa, the match rate for visa seeking applicants has historically been very high and continues to increase. So don't worry too much about the visa issue. But if you have questions about H1 or J1, let me give you a brief kind of an idea, especially when it relates to IM or pediatrics. So if you are unsure about your future goals and you have the choice in the residency to pick a visa, then pick H1. However, if you are planning to do fellowships and you get matched into a good university program, then they're on a case-by-case basis. If you have the option, go for J1. That's a good option in a top university program if they give you that option. Now, the question is, if you are planning for fellowship, say in nephrology, geriatrics, sleep medicine, ID, etc., there are enough fellowships available even on H1. So don't do the mistake of taking a J1 visa in your residency if one of these fellowships is your goal. For very competitive fellowships like GI, Hemong, cardiology, pulmonary critical care, you look at the programs and their in-house fellowship. If they have in-house fellowship and they have a track record of matching their own graduates, then even if they give you a J1, probably you can go with that. However, the situation is a bit different if you are, say, in pediatrics. In pediatrics, most of the fellowships other than the pediatrics cardiology are easily available on H1. So, you should go for H1B visa if you have the option. The other thing is it will be very difficult for you to find waiver jobs in the subspecialty of pediatrics. So if you do a J1 residency and a J1 fellowship in pediatrics, you may actually have to find a waiver job in general peds. So waiver jobs in pediatric subspecialty are hard to find, and you have to consider that if you are given the option of choosing the visa. In the end, if it comes to visa and you're interested in fellowship, remember that where you do the residency matters more than the visa. So for example, if you're doing residency at a top university or say Cook County, Yukon, etc., the number of interviews you will land for fellowships are going to be very, very high anyway, regardless of the visa. So the type of the program and the training you get there, and of course the fellowships that they may have in-house and the match record, the track record of matching into fellowships, you all have to consider that when you consider and if you have the option of picking the H1B or the J1 clinical visa. Now, it does not mean that if you get H1B, you cannot match into a competitive fellowship. In such cases, if you're not able to match into a competitive fellowship, a lot of students do 2 or 3 years of job. They build their CV and then they apply again for fellowship, and that would be the way to go if you're interested. The other term you will hear a lot on this USMLE trail is the NRMP match, NRMP algorithm, or just the match. Now, what is this NRMP algorithm? So NRMP is a system where you will rank order the programs after you've interviewed. So let's say you've interviewed at 5 programs. You will register in the NRMP system and you will rank them in the order of preference. Now, the order can vary depending on your geographical preferences, the training, or other factors. But the fact is that once you interview, you have to rank the programs. That is what is done in the NRMP system. And the programs also rank all the applicants that they interviewed, or most of the applicants that they interviewed. It also happens in the NRMP system. So for example, if a program has interviewed 200 applicants, they can rank 150, 160 of those applicants for 10 spots in the order in which they like them. So in the end, the algorithm runs and the matching happens. So we have done a lot of videos, other videos on the NRMP match. So I'm not going to go into details of how all this happens, but there are a couple of things I want you to be aware of. As a candidate, the NRMP algorithm favors the applicant. So you should rank the programs in the order where you want to go and not worry about how the programs will rank you. That's the first thing. Second, be aware that there are few programs in all specialties that do not go through the NRMP match. They are called pre-match programs. So you will still apply to these programs through ERAS. And if they offer you an interview and an eventual position, they will ask you to withdraw from the NRMP match. So This happens outside of NRMP, and that's why they are called a pre-match program. Finally, the results of the main match are announced in Monday on mid-March. And even after this match, there may be programs that have vacant spots, and there are applicants, of course, who have not matched. So in that week of match, what also happens is something called SOAP, the Supplementary Offer and Acceptance Program. This is only for the applicants who have not matched in the NRMP or pre-match. So you apply to the programs where there are still spots, and the programs can interview you and make you the offer during that match week itself. So at the end, some more applicants can get matched and programs can fill in their position. This is called SOAP, S-O-A-P, and you will also hear this term quite often, especially around the rank ordered list deadline and during the match week. So hopefully it gave you a bird's eye view of the entire USMLE process from scratch to match. And while the process may sound complicated, remember that the IMG match rate is more than 50%. So you can definitely match in the USMLE. Also, we have detailed videos on each one of these 10 steps that we just spoke about. So feel free to check them out. And if you need any help, reach out to us. We can help you in your rotations, in your match journey, ERAS CV, personal statement, research, and interview prep. And good luck for your USMLE journey.